Welcome to NASM CPT exam practice test. Our topic today is practice test 5. Use the link in the description to download the app on the App Store for free practice tests. Number 1. Which of the following is responsible for initiating the stretch reflex during active and passive stretching? A. Ligaments. B. Tendons. C. Golgi tendon. D. Muscle spindles. The correct answer is D. Muscle spindles. Explanation. The muscle spindle is responsible for initiating the stretch reflex, counteracted by the Golgi tendon, to reduce injury during passive and active stretching. Ligaments and tendons are connective tissues. Number 2. A potential client is referred to you by a doctor and calls to schedule the initial consultation. During your meeting, he informs you that he does not want to schedule the first session just yet, and he is merely gathering information. Per the trans-theoretical model of behavior change, this client is at which stage of change? A. Action. B. Preparation. C. Pre-contemplation. D. Contemplation. The correct answer is C. Pre-contemplation. Explanation. This client is at the pre-contemplation stage of change, per trans-theoretical modeling of behavior change. During the pre-contemplation stage, the client is not yet ready to make change and is not motivated by the benefits of change now. During the contemplation stage of change, the client is aware of the negative effects of the behavior and is considering change within the next 6 months. Both the preparation and action stages of change come after the client has a relationship with a personal trainer and a plan of action. Number 3. A person who is exercising at a moderate to high altitude must reduce the intensity of a workout to keep the heart rate in its target zone. This is a result of what characteristic of blood at a high altitude? A. Oxygenation. B. Density. C. Pressure. D. Temperature. The correct answer is A. Oxygenation. Explanation. At higher altitudes, air contains less oxygen than at sea level. Because there is less pressure to force the reduced oxygen into the blood, it is unable to deliver as much oxygen to the lungs as it would with higher levels of oxygen. While the pressure, density, and temperature are all different at various altitudes, the lightheadedness experienced by the exerciser is a direct result of a lack of oxygen. Number 4. What is the maximum daily caloric deficit recommended for weight loss? A. 300 kilocalories. B. 350 kilocalories. C. 400 kilocalories. D. 450 kilocalories. The correct answer is C. 400 kilocalories. Explanation. A person whose goal is to lose weight and decrease body fat should decrease his or her daily caloric intake by no more than 300 to 400 kilocalories. Number 5. Which key movement would best help a client improve his or her functional rotational movement? A. Unilateral rows. B. Hay balers. C. Thoracic matrix. D. Bilateral presses. The correct answer is B. Hay balers. Explanation. Hay balers require stabilization of the core in all 3 planes of motion, and the weight transference through the hips and legs helps gain leverage and maintain balance. Number 6. A regular member of your gym approaches you asking for advice for pain that is running along the outside of his thigh to his knee, and you recommend myofascial release. What overuse injury is he likely suffering from? A. Bursitis. B. Tendinitis. C. Lateral epicondylitis. D. Iliotibial band syndrome. The correct answer is D. Iliotibial band syndrome. Explanation. Iliotibial band syndrome is an overuse injury that causes pain along the outside of the thigh down to the knee. Lateral epicondylitis is another name for tennis elbow. Tendinitis is an inflammatory response in the tendons caused by a new increased level of demand on tendons. Number 7. During a 6-month review with your client, he has decided that his current gains in strength are substantial enough that he would like to move to a maintenance program. What term best describes the close of this portion of his program? A. Variable goals. B. Capping. C. End review. D. Evaluation. The correct answer is B. Capping. Explanation. Capping is a term used to describe the cease of a program prior to reaching the end goal. This may be done because the end goal has been deemed unrealistic, the current gains have been good enough, or the small gains between current ability and the goal are not necessary for success. Number 8. Which functional exercise improves thoracic extension? A. Supine 90. B. Rocking quadrupeds. C. Shoulder bridge. D. Spinal extensions and spinal twists. The correct answer is D. Spinal extensions and spinal twists. Explanation. Spinal twists and spinal extensions are thoracic spine mobilization exercises. The supine 90 hip rotator stretch improves hip mobility in the transverse plane, the shoulder bridge improves hip mobilization with glute activation, and rocking quadrupeds are for posterior mobilization. Number 9. The primary role of which ligament is to prevent medial valgus on the knee? A. Meniscus. B. Medial collateral ligament. C. Anterior cruciate ligament. D. Posterior cruciate ligament. The correct answer is B. Medial collateral ligament. Explanation. The medial collateral ligament is responsible for preventing medial bending on the knee. Number 10. Which injury is defined as a stop in the continuation of bone continuity? A. Fracture. B. Sprain. C. Strain. D. Hypoxia. The correct answer is A. Fracture. Explanation. A fracture is a break or disruption in the continuation of bone. They are deemed either open or closed depending on whether the broken bone pushes through the skin after injury. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.